Hi, welcome to Psychology Matters. I'm Dianne Bradley, licensed marriage and family therapist, and it's good to have you here today. Psychology Matters is a show about different psychology subjects, mental health issues, and it's really our attempt to educate, share, have professionals in the field come on the show and share what they do. So today I'm really excited to have someone that I think a lot of, and that is Stacey Jagger. And Stacey, you're a licensed marriage and family therapist as well.
I am.
So
Thank you for having me.
It is great to have you here.
Thank you.
You know, we don't get to spend this kind of time together to just sit down and chat about what we do.
Right. Thank you for having me.
Well, let's see. Let's share with the audience what it is you do. You work chiefly with children.
I do.
And often we don't think about children in counseling or therapy and what goes on with them, what kinds of things would bring them in for, you know, to work with a licensed marriage and family therapist. So let's see if we can just talk about the kinds of things that parents might bring a child in for.
Okay.
Do you mind?
Probably the number one thing that I hear is around the age of 8 or 9, lots of children, that's sort of the onset of anxiety for kids. So I get a lot of calls for 8 and 9-year-olds with anxiety, depression, and such. I also get a lot of calls for divorce.
Oh, yes, I would imagine so.
Yeah.
Children, you know, that have parents that are
Right.
divorcing.
2 homes.
And there's a big adjustment.
Right.
It's probably traumatic for them when that happens.
Yes.
Yeah, okay. So if you don't mind, can you just kind of share how it is that you can work with children? I think it's very different working with children than working with adults.
It's extremely different.
And a lot of people don't realize that.
Yeah. Okay, so first session is always a parent consultation where the parents come in to talk with me, and that's when I do a full history on the child. I take a timeline of their life, starting from, you know, in utero, how the pregnancy went, and such. I'll ask questions like, did you stay home the first 12 months? Did you breastfeed, bottle feed? How did the bonding process go, and such? Right. Then around 18 months is when you know if you have a strong-willed or a sensitive, a strong-willed or a compliant child. And that's something that's good for me to know, mainly because I want to know if they're leaning anxious or if this is more of a strong-willed child that needs some structural therapy within the family.
Right.
Yeah.
Okay, so you do a full assessment, and that can involve a lot of different things.
Right.
So let's say now you have a good sense of the child's background and what you're working with, you know, what the parents have reported, what you're seeing. So what kinds of things do you do with a child in therapy? Because one of the things that I think I know is what is not helpful is when we're pursuing information with a child.
Yeah, that doesn't work with a kiddo. So session 2, I do what's called the Marshak Interaction Method Parent-Child Dyadic Assessment.
Well, that's a mouthful.
It takes about 40 minutes. They come into my office that's full of, I have 2 sand trays and art materials and all kinds of fun things in my office. It's a fully functional play therapy office. And the Marshak is awesome because it gives me about 40 minutes to observe the child. It's a theraplay-based assessment that I'm able to see how much structure, engagement, nurture, and challenge is going on in the family system. And I work in dyads, meaning 2, so I'll do the assessment with mom and child, and then I'll do the assessment with dad and child, session 3, and then session 4 I'll do a parent consultation again, where I will go over that assessment with both parents whenever possible. And that's when I craft a treatment plan for the child.
Okay. So one of the things I know about you, you are also a registered play therapist.
I am.
So let's share what that really means.
Well, really, I'm a family therapist,
Mm-hmm.
and I specialize in integrating children into treatment for the whole family.
Right.
So I can't really say that I'm a purist play therapist. I'm really more of a purist systemic family therapist.
Okay.
And I'm able to use a lot of really beautiful, wonderful play therapy interventions that work for young children.
Okay. So one of the things that you mentioned that you have in your office,
Mm-hmm.
and I know how creative you are.
Yeah.
You're really quite creative. You mentioned that you have the sand tray,
Mm-hmm.
and a lot of people might not know what kind of sand tray we're talking about.
Yeah.
And how it is that you use the sand
Mm-hmm.
tray, directed, indirected, whatever.
Right,
Can you
right.
share
Sure.
a bit about that?
Yes. So a child cannot actually tell me exactly, if I ask a child, tell me what is making you feel depressed. They can't really tell me why. They don't really know.
Right.
But with the sand tray, they can tell me their story in the sand using metaphor. And so I have all kinds of miniatures there in my office where they can put those miniatures into the sand tray and begin to tell me a story about the characters in the sand. And after working with children for a while, you kind of pick up on what character is them and who they're talking about, and this is mom and this is dad, and they're able to externalize their story in the sand tray, and I'm able to pick that up and sort of be their secretary and tell,
Right.
and they're able to tell me their story in a metaphor format.
Right.
And then I'm able to pick up that story and sort of translate it for the parents, and I'm able to shift what's going on in the family system based on the child's need. So I'm following the child's need based on what I'm seeing in session.
Such a unique way to do it, and the child doesn't realize this. The child's just
No,
having fun.
But having fun. Yeah.
So I would imagine that he or she gets to choose, which character. You have lots of character choices. And so the choices that he or she makes in who he is, whether he's a big hero or whether he's, a little shy rabbit or whatever, and then what all the other characters are of. That tells a story in
Yes,
itself,
it does.
right?
Yeah.
Okay.
Yeah.
So you get a really good sense of what's going on and how the inner world of the child, and how he or she's making sense of things.
The sand tray is great for that purpose.
Right.
Yes.
Right.
Theraplay is more, there's directive and non-directive play therapy. Child-centered is more non-directive. Theraplay is very directive. That's the bonding part. So in the beginning, I usually do lots of non-directive work with a child, but I'm always sort of, the trauma work they do with me, and then when it's time to do the bonding work, I always bring the parent in for that piece, which is the theraplay piece.
And that's where you're working on the bonding between child and parent.
Right,
Or
right.
parents.
That's right.
And
That's right.
so, we have this thing that we call attachment theory. So I'm imagining that you're working from that perspective, a secure attachment with that parent.
Correct, correct.
And do you find when you do that kind of work that helps alleviate some of the anxiety?
Yes. What I tell the parent is that if there's any trauma or perceived trauma or, in a divorce scenario, most children are covering up their feelings of how they really feel about it from both parents. There really needs to be a third person involved to help with that piece, that they don't really want to share with either mom or dad. And that is where I'm sort of that safe container for them. But when it's time to do the bonding work, I don't actually want the child to bond with me. I want them to bond
Right.
with their primary caregivers. And so
Right.
that's when I bring the parent in for session for that piece.
So this is not so much parents bringing a child to you, dropping them off, and you do all the work and make them all better.
That's right. What I tell parents is I don't do any drop-off therapy at all.
Because they do
It's just-
spend so much more time with the parent than they do with you anyway.
Well, the drop-off therapy method I just don't find to be efficient or effective. And so I'm real honest about that in the beginning, that this is a family affair.
Okay.
Yeah.
So let's talk about some of the other things that you do with children that
Okay.
tend to be, I don't know, fun. I would
Mhm.
imagine that there are some children that actually look forward to coming to see you.
Yeah,
Because if-
especially the creative ones.
The creative
You know,
ones.
if they're in school all day and they've been sitting at a desk
Mhm.
and you know, taking tests and such, they're pretty excited to come see me at the end of their day. Yeah.
And play
Yeah,
and be
play
creative.
right.
What
right.
other kinds of things do you use? I know you use the sand tray. Do you
Mhm.
use things like
I have puppets.
puppet
I have a
play?
dollhouse. I have an art station with markers and paints,
Mhm.
colored sand,
Wow.
all kinds of fun.
You know, you mentioned puppets. It really
I have a
is.
music station with a happy drum, HAPI, with a guitar and a dulcitar, and you know, just whatever the child is drawn to, I can
Anything.
use as a tool for their therapeutic work. Yes.
When you were talking about the puppets, I was remembering how powerful things that we wouldn't imagine can be for children and working through processing something.
Mm-hmm.
There was a case once with a child that had been adopted
Mm-hmm.
and had never been able to talk about where he came from.
Mm-hmm.
And in the waiting area, there was a lion puppet. And while he was waiting with his mother, while I was working with Big Sister,
Mm-hmm.
he played with the puppet with his mother. And when they came in afterwards, she was amazed. She said, I just heard the story of what he thinks happened to him because he used the lion
Mm-hmm.
to talk to Mom to
Mhm.
tell her where he
Right.
came from.
Right.
It was incredible.
Yeah, they will disclose through a puppet or through music, you know, what's really going on with them. And if you're attuned to the child, you can really pick up on those little nuances and things that they're saying, and really hear them.
Yeah.
Yeah.
So how much of this do you find that you are educating a parent in how to work with that child or how to do some of the same things that you do in your office to be able to do that at home?
Yeah, I do a lot of therapy training with parents because I find it to be very effective.
Yeah.
It's very simple and easy to do at home. One thing that I do after session 4 is I see the child by myself for a session or two to gain a therapeutic alliance with the child.
Mm-hmm.
But many times, probably 80% of my clients now do what I call the 30-day blackout.
Oh, tell me about that.
Well, that's where everybody turns everything off for 30 days. And
Phones, television?
everything gets turned off for 30 days. And you know, they look at me in the beginning like I have 6 heads, like, are you really saying what I think you're saying? And I explain that the first 5 days are very hard. You're going to blame the whole thing on me. And then day 6 and 7, the children walk through what I call the Door of Boredom, where they think boredom is going to kill them.
Yeah.
And then the next 3 weeks after that, their brain starts to reset to a new normal, where the family starts to replace connection activities for entertainment. And the next 3 sessions after that, with all the families I work with, what I say is we're going to climb a mountain. We're going to start at the bottom. We're going to climb up. At the middle point, you're going to tell me. And then we're going to keep on climbing up. And right before the top, you'll tell me that's when I'm going to graduate your child from counseling. So in all, if you looked at my files, it's about 12 sessions. But for the families that choose to do the blackout, we climb this mountain really, really quickly, because what I found is that parents have what is called split attention, you know.
Yeah, looking at your phone.
You're
hearing
on your
child.
phone, but you know, the child
Right.
needs your attention. And a lot of the behavior problems that I'm seeing with children are simply a strategy for attention and connection with the primary caregivers.
Yeah.
So when you take all that away and they, you know, and you're giving your child the message, I see you, I hear you, I delight in you, I celebrate you, I only want to be right here with you, I don't want to be anywhere else. The physiology of the child relaxes, they're able to focus. And then those parenting strategies that I teach, like yellow light, let's slow down and try this again, I'm going to give you 2 choices, which one do you want to do, become much easier to implement. And And the more connection there is, the behavior problems just sort of float away and become
so
a
everyone in the
non-issue.
family benefits. There's
Exactly.
peace,
Right.
there's more harmony in
Right.
the family.
Right.
Yeah, I was thinking about that 30-day blackout. I bet you do get some pushback in the beginning.
I do. Some families do a brownout. That's when a family chooses to do no more than 30 minutes a day with anything with a screen. And I've seen that that's, effective as well. But for those that do the blackout, it's pretty severe, and they're ready for change. And that's when I say we're going to an 1850s cabin with nothing but a shovel for 30 days.
That's a pretty good metaphor.
Right.
So let's just talk a little bit about how families interact at home and what you see. I would imagine that when you're able to help them connect with their child through, I don't know, eating dinner together,
Yeah. Right.
board games maybe
Right.
once a week, things like that.
Right.
Does that make a difference?
Yes, I explain to families that the hormone oxytocin is released when you're having dinner together as a family, that eye contact is very important. One of the first things that I look at when I'm working with a young child is how much eye contact am I getting from that child.
Right.
And because of so much screen time, I found that lots of kids just can't really maintain prolonged eye contact.
Right.
Because they're just not getting the connection time that they really need. So
And
that's
so-
sort of, where I begin with
Yeah.
with lots of kiddos that I see in my office.
So when you have those family times together, like dinner at the table or board games,
Right.
and if
family
you have
walks,
family walks, it gets
Right.
easier and easier for them to maybe look at the parent in the face
yes,
to feel a little more connection.
right,
Yeah.
absolutely.
Well,
Yeah.
you've done a lot of good work. I happen to
Thank you.
know that you've done a great deal of work that resulted in a book that
Yes.
you've written.
Right.
And if you don't mind, I'm going to show this.
Okay.
I'm going to show the book here. The book is a letter from Emma, Safe in Amish Country and Beyond, because you've worked with a rather unique population.
I have.
And worked with children.
I have.
And that, I can only imagine that must have been quite an experience for you.
Yeah. Priceless, really.
Yeah.
Yeah. Would you like for me to tell a little bit of the story
I
behind
would
this
love
book?
for
Okay.
you to tell us about it.
Well, probably 4 years ago now, I got a call from my midwife. Now, I've had 4 children of my own. 3 of those were born at home. And so I shared a midwife with, my midwife also works in an old order Amish community. And she called and said, there's a family in great need. Would you be willing to do some pro bono work out here? And at the time, I think I was 7 or 8 months pregnant, and I just couldn't pull it off. But after the baby was born, this is my 3rd child, after she was born, my husband, who was raised Church of the Brethren, which is actually sort of a branch off of Mennonite, he had said, if you want to go out there, I totally support you, and I got this, and why don't you go see what you can do to be helpful. And so I did. I ended up working with several families out there, but one primary client who had a very unfortunate experience with an Englishman who went to the Amish community under the guise of wanting to help at a barn raising, and ended up violating a number of the children in the community, which ended up becoming a public court scenario. He is now incarcerated. But the girls were court appointed a male therapist that they refused to see, and so the midwife asked if I would work with them, and so I did. And it was
Wow.
I wouldn't give $1 million for the time that I
So
spent
did
with
you
them.
go to them, or did they
So
come to you?
part of the time I would go to them, and then they would come to me. They would have an English neighbor, take them to my office, and so we kind of went back and forth for about 3.5 years. Yeah.
Wow, what was that
Yeah.
like, going into their home
Right.
and family setting and working with children?
Yeah, the families are so large that we ended up doing group therapy in their barn, which was fun. A lot of play-based experiences that I was able to lead with them, with the things they were already comfortable with, like puzzles,
Right.
dominoes,
Right.
simple activities that were play-based, but that they were able to respond to. Worked quite well.
So the work that you did resulted in this book, from A Letter from Emma, and Emma could be a person in a community like that.
Right, right.
And it's really beautiful.
Thank
I'd really
you.
want to show. These are all pencil drawings.
Yes.
And I guess this is Emma here.
Yes.
It's quite lovely, and it's a
Right.
book that could be read by parents to their children, and just empowering children.
Yeah,
right?
what I found, because I did a lot of research of other sexual abuse prevention books, and I did not find one that wasn't, they were all very graphic
Right.
books that the Amish population, they were not going to, that was just too much information for
Right.
them.
Right.
And so I was able to write this through the voice of an Amish child to
Right.
warn other innocent children of these are the things that you want to look for in a predator, and what to do if you had already been hurt.
What a great idea.
Yeah, thank you.
That's quite an
Thank you.
accomplishment, too.
Thank you. Thank you.
So, our viewers, part of our mission here is to really inform and educate our viewers. So, maybe you could share some of the things that adults, especially parents or teachers, could look for, watch for in children that might be struggling in whatever way.
Yeah.
Whether it be that there's been abuse,
Right.
whether it be physical or sexual, or that they are suffering from extreme anxiety, or they've gotten some news, mom and dad may be divorcing.
Yeah.
What kinds of things do the adults need to look for to help that child?
It really depends on the age of the child. So a 3-year-old is going to be much different than a 16-year-old, as you would know.
Yeah.
But one of the main things that I would say is, are they isolated? Are they withdrawn? Does it feel like the twinkle in their eye has gone away?
Right.
Are you not able to reach your child for some reason?
Right.
And you can sort of intuitively feel like something is wrong and I can't quite put my finger on it. And I would say just the assessment process alone, I do the assessment with lots of clients and don't necessarily go forward with a treatment plan, but I'm able to give enough feedback
Right.
to a parent to say, this is what I'm seeing and such.
Yeah. Or big changes, even if they see big changes.
Lots of excessive crying, children that
Yeah.
can't stop crying. They're having a difficult time in the middle of the night. They can't sleep alone.
All those.
I'll never
kinds
be
of-
bored because every child is different and every
Yeah.
family's different.
Yeah.
But most of the time, parents know when something is wrong, and they need to make a phone call for someone to help.
So let's see what we can do about sharing with adults, with parents, guardians, caregivers, how it is to find a good fit, the right kind of therapist for a child. Because, I used to do a lot of work with children, but my office is no longer suited for that.
Right.
And even the environment makes a difference, does it
Yeah,
not?
yeah. For the ages 3 to 12, I would highly recommend that you find a play therapist
Right.
to work with,
Right.
because play is the natural language of a child, and talk therapy just really doesn't work for a
Right.
young kiddo.
Right.
Yeah.
And I would imagine you could find yourself just being overly inquisitive and therefore pursuing information, and that
Right.
could feel
And
like
it shuts them down even more
Yeah,
by
yeah.
asking them
Yeah.
lots of questions that they can't
Yeah.
really answer.
So that's the kind of question that a parent could ask: is Are you a registered
Are you a
play
registered
ther-"
play therapist?
And that can make all
And the
difference.
Association for Play Therapy, you can go to that website, and there's lots of very competent clinicians there that you can find. Yeah.
Well,
Yeah.
you're a wealth of information.
Thank you.
And I want to thank you for writing this book,
Well, thank
because
you.
I can only imagine how many children that this can save by writing the book. And I
Thank
mean
you.
that
Thank you.
sincerely.
Thank you.
So it's such a pleasure to know you, and it's so good for you to take the time to come here today. So thank you
Thank
very
you,
much. Thank you for
Dianne.
sharing.
Thank you.
And so for all of our viewers, we'd like to say thank you for watching Psychology Matters. And we want to invite you to check us out on Facebook, and ask questions, make comments, like us, and share. Watch for our upcoming episodes as we hopefully continue to share information with you, what's going on in psychology, mental health issues, and answer some of those questions. Thanks again, and be sure to tune in for our next episode of Psychology Matters. Hi, Dianne Bradley here. Thank you for joining us in Psychology Matters. We're really concerned about informing you on different issues: psychological issues, mental health issues, mental illness, depression, anxiety, trauma, post-traumatic stress disorder, children's issues, addiction. There's so many. And we're really interested in knowing what you think. So look us up on Facebook. Like us, share us, subscribe. Check us out on YouTube at Psychology Matters TV, and just let us know how we're doing. Let us know if you have a topic that you'd be interested in us covering. We're glad to have you. Thank you.